In August 2020, the alarm was signaled by the Ministry of Health and Wellness that the island has an official dengue outbreak. Since then, the ministry has ramped up its effort at sensitizing the public on best practices to eradicate breeding sites for the pesky Aedes aegypti mosquito, the carrier of the virus. Following Thursday's announcement that one man had succumbed from a severe case of dengue virus, a press conference was held on Friday to update the nation on the outbreak. National epidemiologist Dr. Michel François says data indicates that the island has two varied serotypes of mosquitoes, which is cause for concern.
Although both serotypes 3 and 2 have been recorded in St. Lucia, serotype 3 has accounted for the majority of cases. And the fact that we have two serotypes in circulation is also of concern because, as I indicated, during an outbreak, an individual can get dengue twice. And having been infected with one type, you are more predisposed to the severe form. So we are quite worried and monitoring our cases of severe dengue and what is happening on the ground.
Dr. François discloses that almost 3/4 of dengue cases are asymptomatic or present with mild signs and symptoms. The age group 5 to 14 accounts for 39% of confirmed cases, leaving health officials worried about the vulnerability of youth. The north of the island has been identified as the hot zone of active dengue cases.
The highest number of cases continue to occur in the northern part of the island. Castries, Grosselet, and Babonneau. Vieux Fort has accounted for 13% of the cases, followed by Dennery, 10%, and Micoud, 6%. To date, there has been one dengue-related death. The case is a male adult, 65 in the age group 65 plus, who resided in the north of the island. The gentleman also, he came in with signs and symptoms of dengue. However, he had several underlying medical illnesses which predisposed him to a more severe form.
The warning signs of severe dengue were outlined by Medical Officer of Health, Dr. Glensford Joseph.
Severe dengue, where the patient experienced significant fluid loss, a significant fall in their blood pressure, which we call shock. They tend to develop respiratory distress and severe bleeding with severe organ involvement, that is multiple organ failure. Infected persons have overall a 1% chance of dying from dengue. However, with the severe form of the disease, this increases to 2 to 5%, and if left untreated, severe dengue can result in a 50% chance of dying.
As of September 2020, the Ministry of Health has registered 503 confirmed cases of dengue. However, officials underscore that this by no means represents the total number of cases. Persons presenting with mild symptoms were encouraged that if medication is self-administered, that paracetamol should be the pain reliever of choice, as ibuprofen and aspirin can worsen bleeding in persons with dengue. Solange Alfred, HTS News Force.